Hi, welcome to this unique haircare initiative by IPCA. I'm Mona Sharma. It's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory. It makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when you used to lose hair or have thinning of hair or bald patch hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring at the younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Dr. Dennis Hennry is a well-known dermatologist and has been practicing medicine for over many years now. He is MBBS MD, specializes in dermatology, cosmetology, and trachology. He is currently practicing at Dr. Hennry's Skin Clinic, Bilaspur. Dr. Hennry has dedicated his career to diagnosing and treating a wide range of skin and hair conditions while providing personalized hair care services to his patients. He takes time to listen to his patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Henry is also aware of the need for the patient awareness about hair and skin care and spend a lot of time in giving talks at various platforms across the country. Thank you so much, Doctor, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to this YouTube live show.
Thank you so much, Dr. Mona, for having me here.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया एंड टुडे वी आर गोना टॉक अबाउट लाइक हेयर केयर इन करंट सिनेरियो एंड जब भी हम हेयर केयर के बारे में बात करते हैं विद वेरी कॉमन प्रॉब्लम व्हिच इज फेस्ड ऑल ऑफ us like hair loss irrespective of gender and age. So with your profound experience, can you please enlighten us today like what's normal and meant to be concerned for?
Usually, I think it's okay to lose about 50 to 100 hair strands a day, but sometimes what happens is a lot of times when you're losing hair, there is already another hair to replace that place. So, hair actually works in cycles. Sometimes the cycle is prolonged or shortened because of many reasons that we can discuss later. But the point of balding comes where we have lost more than 50% of hair volume, and this becomes a concern. But if you actually want to get yourself treated before that 50%, there are very subtle signs, like when you wake up you will see your bed sheet full of hair, or when you are showering your shower head will be full of hair, or the drainage will be full of hair. So these are the signs where you must think about that maybe you need treatment. Apart from that, anything which concerns your daily routine, might be itching of the scalp, that can be a reason to think about that you need a treatment for your hair.
Very interesting, doctor. So, doctor, like when a person is going through the hair problem or hair loss thing, he keep asking himself like why it's me, मुझे क्यों हो रहा है? So, like, can you please like tell us like what are those general causes of hair loss?
General causes of hair loss, what I have learned so far, actually depends on the gender. If you are a male, you will have male pattern hair loss, and if you are a female, you will have a lot of different causes of hair loss as well. So what we have to look in is where are we losing our hair from, because males have a specific pattern, females have a specific pattern. So as a rule of thumb, if I get a female patient in her young age having hair fall, a lot of times they have nutritional deficiency. So just a multivitamin might help in that case. A lot of times they have their menses are irregular. It's not in sync with what they think it should be. That can be a hormonal problem. So it is a very, very wide range of diagnosis that we dive into. But certainly, to name a few, can be something like a nutritional deficiency, can be something like our androgens or our hormones are not working the way it should, or something like an infection or a disease or an inflammation. So it is a very, very broad question which might take almost hours to answer, but we can probably use these headers and classify them like that.
Okay, interesting, doctor. So, doctor, like when we are talking about causes, we are also like living a lifestyle which is like very busy, and we eat whatever is available. We don't see the nutrition quality. So, can a person lifestyle play a role in hair loss?
Yes, definitely. We do know that smoking and drinking has had their history of data where it comes to hair loss. So that definitely goes with it. The kind of stress that we do, there is a disease where a person will actually pull their hair out because of the stress. So controlling stress is very important. Another thing is a lot of times people have these unexpected expectations from their body where they are not being very realistic. I've had one patient, she came to me with profuse hair loss. So I asked her what's going on, and she said she is getting engaged, so she wants to lose weight fast. And then she has put herself on what she called as the patta diet, which is just eating cabbage the whole time. And as we know, that cabbage also reduces your thyroid hormones, so and thyroid plays an important role when it comes to hair along with the nutritional deficiency.
Mm.
So it's always going to be lifestyle for anything that concerns skin, hair, nails, because that is something that makes a lot of difference.
Okay, that's very interesting. Because of like when people are losing weight and when they go into like a kind of a crash diet, that can also lead to hair loss. So, doctor, when we are talking about all these things in this era of internet informations, people are like quite confused, like what is the right treatment for them, and they just get scammed and then they regret. So, can you please, with this platform, can you please let us know, like what are those medical treatment options available for hair loss, like surgical, non-surgical, or any other?
So I will just try and make this simple for everyone who's watching the video. When it comes to hair fall, um, whenever your doctor is treating you, if your dermatologist is treating you, ideally you should go to a dermatologist for your hair concerns. Now, whenever your doctor is treating you, we have a central treatment. Let's say someone has a disease or an infection. So that infection, the treatment of that infection becomes the center of our treatment, and everything else will be in the periphery. In similar way, if someone has nutritional deficiency, so that becomes the center of the treatment to correct the nutritional deficiency. Everything else, like your shampoo you are using or the conditioner you're using, they are all just add-ons. They don't really treat what the cause is. So, to actually treat the patient effectively, you must also diagnose the patient effectively and think about where we are trying to go forward with our treatment. And as far as treatment is concerned, well, everyone knows there is so much available online. I have also tried scanning my own scalp and sending it to one of the drug company, which claim that they will cure my hair loss, and it never worked. But before I realized that it doesn't work, I have already spent about 10,000 rupees on the same thing. And we often think that we are saving money by not going to a dermat, but it is the other way around. You just don't realize how much you spent on these things. So there are creams and lotions available. There are sprays available. Of course, your shampoos and your conditioner come as daily thing for most of the things that we treat. There are tablets available where if there is a hormonal cause, you are blocking the hormones, or there is a multivitamin which can go with almost anything. If there is some sort of inflammation or some sort of disease, we would like to treat it that way. And invasive therapy, if you think about, platelet rich plasma has been a really long time. We do that. Sometimes you can add a thread, or you can now the latest ones are stem cells injections and exosomes, which we do. And at last, if nothing works, there's always an option for hair transplant. But a lot of misconception that people have is after hair transplant they don't have to take anything and they are free to go, which is entirely wrong. Hair transplant is just another trial of preserving those hair follicles through medications after the transplant. So that becomes an important part.
Okay, that's very interesting. So it is important that when you get a treatment, you should go to the dermatologist instead of going to some XYZ people and just getting the treatment and getting frustrated and then coming to the doctor and asking, oh, what is happening to me? Very
So
interesting, doctor. Uh, so, doctor, there is one when we are talking about these treatment, there is one word called nutraceutical, which is getting a lot of focus. So, is this nutraceutical like what is this, and is this really helpful in hair health?
nutraceutics have there a really really long time, and we just didn't know it exists in the way that it functions right now. There are few things like phytonutrients which actually work on balancing your hormone. There is a new compound which has come up. It's a nutraceutic. It's called berberine. It's there to manage menses of the females right now and help reduce weight. But I have been a fitness trainer and a diet instructor since quite some time now. And when it's actually very surprising to see how both of them merge together and compile and sit right on top of each other. There's been green apple extracts, or what we call as Mallus domestica, or there are turmeric extracts, or there are watercress extracts, or so many things that are added up on the new products. And nutraceutics have become the new trending thing to be covered right now by all the doctors and the drug companies. They've been there for a really long time. We just didn't know that they work in this manner. And now, where we are implying it in hair care, some of them have shown promising result, and some of them have to be studied a little more. But definitely, they do have their own place.
Okay, very interesting. So, doctor, there are like so many kind of plant extract like grape seed or omega 3 fatty acids or something. So, can they really promote hair growth?
Long answer is yes, and short answer is no. They don't really show immediate changes. Like we feel like, okay, I've taken this for 10 days, so I want it to be all full of hair. But their deficiencies have shown to cause a lot of volume loss in patients who have it. So definitely that is a key factor. A lot of times you are having hair fall just because your body is reacting to all the stress and the food that you're eating, which medically we call as inflammation. Here, omega 3 and omega fatty acids helps to tone it down. They also help to moisturize your scalp. So in the longer run, they definitely help you. And it is not only for your hair that you should take it, probably your heart health also that matters, your brain health also that matters. These things have a good role that we know about after our researches, that we should add them in our routine.
Okay, very interesting, doctor. So, doctor, is it okay to buy these things by ourselves and eat and popping it by ourselves, or is it required to take these nutrients as per gender RD requirement or under the supervision of doctor?
The line of that is divided right now, but it has been clear since ages. If it's a supplement, probably you can take it because it is a supplement. You are supplementing it to your daily life.
Hmm.
If it's a medication, you are not supposed to take it because medicine is given to someone who has a disease, and probably you need a doctor to supervise you regarding that medication. So that line has always been very clear, but right now, with how the market is changing and things are evolving and people want bigger, better, brighter results, so that has faded away over time. So if it's a supplement, it is probably okay for you to take it. But if it's a medication, definitely you have to consult a doctor before going for it.
Okay, very, very interesting. So, doctor, when we are talking about hair loss, another very common problem which is faced by all of us is like dandruff. So, can a dandruff also cause hair fall or hair loss?
Yes, dandruff is basically a reflection of how your scalp health is. And when you think about scalp, it's the basis of whatever holds your hair follicle. Now,
Mhm.
there are a lot of causes for dandruff, and we are not going to go into detail of it. But if
Yes.
your scalp health is not nice, that means you will have hair loss, irrespective of if your scalp is too greasy or if your scalp is too dry. It's not just that. A lot of times when you have dandruff, it becomes socially awkward for the person who has dandruff. You cannot really wear black t-shirts because it shows. A lot of times people who use minoxidil for hair treatment, for example, have dandruff when they leave minoxidil because of the dryness. So again, we'll have to go towards our dermatologist and ask what is going on. But if you have dandruff, that clearly means that the scalp health is not good, and we need to work on it. Probably if it's dry, we need to oil it. Probably if it's itchy, we need to soothen it down. And again, a very wide open-ended question, but key point, probably if you have dandruff, you should seek treatment for the same.
Okay. So even dandruff is like something जिसको attention देना बहुत जरूरी है.
Bilkul, bilkul.
Okay, very interesting, doctor. So, doctor, like, when we are talking about lifestyle, we are talking about nutrition. Another very common thing is like stress, which is like unavoidable by any of us. So, is there any impact of stress also in our hair health?
Definitely, it's a very funny thing that I keep on telling my patients. You will have stress, which will cause you hair fall, and because of hair fall, you will get more stress, and then you will lose more hair. So it's a cycle that keeps on going. And definitely, that is true because stress, in a way, gives our body a response, or we call it inflammation, which is one of the key things in any kind of hair loss that we have understood so far is inflammation. It just your body shoots the hair out of your hair follicles, and the key reason of that being is hair to our body is not the most important thing that the body needs. There are so many other things that the body has to take care of. So definitely, if we can lower our stress, hair is going to be intact. And also, mindfulness is something that really helps in a lot of cases. And because of stress, a lot of people indulge in things they shouldn't, like probably smoking or drinking or not eating healthy, which can again lead back to hair fall. So it's a cycle, and there are so many endless cycles which keep on adding up to the loss of hair that we can face. So definitely, definitely.
Not eating healthy is my way of coping up with stress. I'll take care of that. Yeah. So, doctor, like when we are talking about stress, the very common formula which is given by all our grandmothers is like massage your scalp with oil, and then they also prescribe you that if you apply a lot of oil, you will have a longer, thicker, and the hair growth will be also nice. So, what is the fact behind this? Oiling hair is boon or a ban?
So far as what we know, oiling per se as a standalone is not really a very beneficial treatment when it comes to hair. It does make it look shiny, and so we feel it actually works. But theoretically, or when we are thinking about researches, oil doesn't have a very vital role in the way that we look at hair fall. Although, when you are putting oil and massaging the scalp, massage becomes an important thing, where there is something where we look into the scalp through a trichoscope, and we realize that this scalp actually needs some kind of massage. And that massage will make your scalp much better. It is also going to promote the hair growth because of that increased blood supply. When it comes to oiling, if you are thinking for oiling, or if you like to oil your hair, or if a lot of people, it is a very good source of tension relief, as we have mentioned. So olive oil and coconut oil seem to show some benefits, so maybe we can revert to those kind of oils. But the key point here I would stress on is more of massage and less of the type of oil and which oil and how much the frequency is.
So, putting a lot of oil thinking that the hair will grow is like a myth.
It is a myth because at the end of the day, you can drench your head in a bowl of oil, but you might still be bald at the end of it.
Very informative, doctor. So now, doctor, like my favorite part, can you please give us like some healthy tips for healthy hair?
Definitely. Let us go as a very big flow chart, and our viewers can actually write it down and find out where they belong. This is not a general treatment advice, and this is not something that is to be followed, although they can consider it with supplementary tests and associated supplementations for their daily life. Let's say, first we have to find out, are you a guy or are you a girl? So, is it a male or a female? Second is, let us shorten the list down. If you are a male, does your dad or granddad have that hair fall issue? And if you are losing your hair from the front and from the upper head area, which is the occipital and frontal, then you are probably suffering or having androgenic alopecia, and this is where you need to take treatment from a doctor. Do bear in mind, this treatment is going to last for as long as you are 50 years of age, irrespective of how you go about it. If you don't want the treatment, probably wear a wig. If you want treatment and you are going for and you think that hair transplant is going to help you escape those daily medication, that is not going to happen, and that is what it is, and it's a hard pill to swallow, but it is the truth. When it comes to females, you want to know, okay, is there most of the females have nutritional deficiency, and this actually applies to males also. If you are getting lower back pain by the end of the day, or you are having a lot of flu or sickness on and off the season, probably you want to get your vitamin D checked, which has become a very rampant deficiency because of the way we have been using sunscreen. Second thing is, if you are a woman and you see a lot of pigmentation on your skin or on your knuckles, probably you want to look at iron and vitamin B, because that is something which is causing that kind of deficiency. If you have faced very sudden weight changes and you have any trouble trying to maintain your temperature, maybe you are feeling too hot or maybe you are feeling too cold, then it depends on your age. Probably you want to get your thyroid checked if you are young, and if you are in your middle age, probably you want to consider if you have any menopausal symptoms where your period is going to stop and your body is trying to adjust to that. Apart from that, always there can be infections and inflammations. So you have to look at the kind of hair fall that you are seeing. Do you have a patch where you're losing the hair from? Probably consult a doctor. That is a disease. Are you losing your hair from roots? Then you have some nutritional deficiency. Is your hair breaking from midway of the shaft? If it's breaking from midway of the shaft, your hair is weak. You need to probably change your shampoo, condition your hair, probably apply a hair mask, and take care of your hair that way. And if your hair has lost its texture, probably split ends. A lot of times people will in India especially, they tend to bend down and beat their hair with a towel on and on. That is something that just by doing causes split ends. So very wide ranged of flow chart that we wanted to keep it simple, but I think our viewers will get a rough idea of where I'm trying to take their attention to.
Thank you so much, Doctor. This discussion was very informative. Can I take some live audience questions?
Yeah, sure, sure.
The first question is, hello, doctor, how to treat hair fall after pregnancy?
Hair fall after pregnancy, we call that term as erosion effluvium. It is nothing, something very normal. About 60 to 90 days is where you can expect to get the hair fall. At this point in time, you have to understand that the roots of your hair are not strong enough to hold on to the place in your skin. So,
Mhm.
first thing is no aggressive combing, no aggressive oiling and rubbing your skin, and no checking how much hair you're losing by pulling it out, because that is something you don't want to do. You don't want to wash your hair very often as well. Multivitamins at this point in time will work really well. You can have some stem cell sprays that are available in the market that work also very well, or you can go for something like a PRP injections is also going to work very well. If you don't do anything at all but take care of your hair in that kind of manner also, it is going to function fine. But do understand that since it is post pregnancy, during the pregnancy time women tend to eat different things, which is not what they consume daily. So maybe there is something as simple as a vitamin deficiency, so you can supplement it and fix it out.
Okay. There is one random question from a viewer. He's asking that doctor, recently I went to a salon and I applied a plant extract hair dye, and after that I've been facing a lot of hair fall. Is it because of the new kind of a dye? And what do you suggest people who have grayed, should they apply any hair color on their hair?
So we call it PPD. It's a short form for the allergen which is there in the hair dye, and PTPB also, which is another fancy term. But what happens is if you have applied any kind of hair dye, and then you have itching right at 20 within 15 minutes, as far as 30 minutes or 40 minutes, definitely do not go for that hair dye again. The dye itself is causing you to have irritation. A lot of times I've seen swollen faces because of just using the wrong hair dye. Something which works for people in graying hair, over time they know what works for them and what doesn't. So it is as simple as trying and experimenting. I wouldn't really take any names right now on this platform for any company which hair dyes do work really well. But definitely it is more of a trial and error thing. But if you are getting an allergic reaction to your hair dye and you know it, do not use that hair dye again, is something which I would definitely suggest.
Okay, very interesting. Another question is, how reliable are at-home skin diagnostic or AI-based skin apps?
um, AI based skin apps and at home diagnosis is as reliable as an AI is to maybe complete your school project file. If you ask AI to write a story, it is very well going to write a story. But does that story really apply to you? Or
Mm,
is the story written in the way that you intended for the story to be have been written? So they do work, and
mm,
we have had enough number of studies where they say it works, but then it is at this point in time you ask any AI a tricky question and it's probably going to give you a very bogus answer. And skincare routine or hair care or at home skin diagnosis is something not that simple, because we spend years to kind of learn it and still we call our work practice. So
mm.
they are not very reliable. Maybe you can give it a try just for fun. Don't trust it.
Okay, very interesting, doctor. So you cannot make AI as your doctor. It's better to go to the doctor. Okay, so I'll quickly ask one last question because we are running out of time. How often you suggest for hair wash as routine, doctor, and is using a conditioner is always mandatory?
Using hair wash and the frequency that we wash our hair depends on the type of shampoo and not really how we like it. If you are using a daily cleanser, because I use it, I work out and I go to the gym and I want to shampoo my hair every day. There are plenty of daily shampoos, or you can see them as gentle shampoos, which you might use every alternate day as well. But if you are thinking about something in most of the market products which is available, which claim to deep cleanse your scalp, the detergent on them is so harsh that it is going to damage your scalp and your hair. So that is to be used probably once or twice a week if your scalp demands for it. And most of the shampoos available in any supermarket that we walk into is not a daily use shampoo, but people use it, and that becomes the problem, not the frequency of when we are shampooing it. And conditioner use is definitely not mandatory, but think of your hair as a gate, and anytime you use a shampoo, the gate opens and the conditioner will actually close that gate back. And when the gate is open, sometimes things that you don't want also enter. So probably using a conditioner is a good way to secure your hair shaft back into place. Sometimes there are many ways to condition. You can probably use a conditioner before you shampoo also. That is also a way. It's called reverse conditioning. But yes, using it would be a nice idea to go about. But just one input from my side is always read the label of the shampoo. And if you see some strong detergent, you can Google. There are so many. There are the sulfate and benzene compounds, and if you see those, Probably not use it more than once, maximum twice a week.
Okay, very interesting, doctor. So, finally, doctor, would you like to give any take-home message or any other suggestion for viewers today?
Take home message for hair and for skin and for anything else which is in our body is the same. You think of anything or any appearance that you have in your body as a daily routine. Someone who works out and lifts weight, it shows, and when they stop also it shows. It's not something which is going to be permanent. It is not something which is always going to be there, but it is something, if you constantly work on, will pay you back. And that payback is in a lot of terms: any confidence that we gain, how we feel good about ourselves, or how we look good in the kind of dress or clothes that we are wearing. So be consistent and treat your body like you love your body, and feed your body what you wish for it to grow. So that is a main tip that I would want to stress on.
Thank you so much, doctor, and thank you so much for sharing all your expertise with us today and answering all the questions of our viewers today. I'm sure the viewers have found the session very helpful. And thank you, doctor. It was a delight to have you, and I really love talking to you. And I hope you have some time in future, and we can connect again and create more awareness among people using this platform. Until then, doctor, please take care of yourself.
Very well. Thank you for having me today. Thank you.
And also, thank you to the viewers for asking so many questions and participating so actively. But until next time, let's sign off for today and see you soon, Doctor.
Thank you. Thank you, all of the viewers for joining in, and thank you, Ipka, for having me and listening to my views. Thank you.